able to bring back 9 Miles of Smiles charity and working and partnering now with UTech University here in Jamaica and bringing 25 dental hygienists, 4 practicing dentists from in-country, along with the Canadian counterparts from 9 Miles of Smiles. You know, we're setting up a sustainable environment for the right type of dental hygiene and education.
We're just so thrilled to have you here, and we really appreciate you taking the time to come here and do this. It's something that means a lot to us. This is one of the favorite parts of my job, is when we're able to do things and take some time out of our everyday to give back to people who really need the help. So we really appreciate it. Thank you very much for being here today.
You know, this clinic couldn't happen without the generous donation of the RCF Foundation. We were here in October, and we didn't have as many clinicians as we have today. So we started with the children at the school and some of the community members. And at that trip, we managed to see 175 people in 4 days.
It's amazing.
Which was still
incredible.
Which was still great. But we saw that there were 48 students out of the 75 children at the school that needed restorative care, that had active decay.
Already.
Yeah, so we're planning to do that this trip. Here at the Bellows Gate Primary School, where they've let us use the resource center. So the dentists are screening the community, taking their blood pressure, getting the initial information, and then they'll be passed off to the students for the treatment. There's a restorative area where we're doing fillings, and we're also doing hygiene in that area. And then there's a surgical area where we have all our instruments, so where the dentists do their extractions. We have behind us here is the surgical room, where it's fully staffed right now with UTech students and their professors. We have 3 chairs running, and this is where they're doing all of the extractions, as well as the treatment planning for future visits.
It's incredible that this group can create a mobile clinic where we can come to a remote area like Bellows Gate and do dental extractions. It's incredible to me.
Yeah, it's wild.
Which is a bit more realistic. You actually have to be on your toes and actually use all of the skills and which you've garnered over the years in order to create a treatment plan for your patient on the spot. And it was a fun experience to do so with others, as we had many competent individuals working with us in order to give their insight and experience over the years in order to help treat each patient in due time.
We've been working on this project for months, planning local volunteers and organizing them for weeks. You know, so this is their first time here, these students. So when they come back in 5th year, I think they're just gonna start even faster.
Whoever came up with the idea, they were thinking the right way, because this is their second time being here. And I would want to say that this is a program that is well received. This kind of expansion and collaboration is good for the students, because they too will grow up to understand that it is important to have good oral health. Through Kimberly and C3 Metals, this is a very good initiative, one that can only serve to educate and to have students understanding that their dental health is important.
I think it's really important to give back to the community, especially in underserved areas. I believe there is a lot of disparity, various factors that cause that, especially in communities like this. I think it's important to give back to them, just to instill good habits, especially in children. Hopefully we can have an impact on them and, you know, instill lifelong healthy habits, especially in terms of dentistry.
The most moving thing I would say is, especially working with those patients that they'll tell you that this is the first time they've ever gotten a cleaning, and they're probably in their middle age. So just being that person who probably did their first cleaning for them and bringing them closer to better oral health, I think that for me just makes the world of a difference, to be that person who really makes the change for their oral health.
You know, it's good to give back to the community, and especially community like these in the rural areas where there not much access to dental facilities. So when we get the opportunity to come into these deep rural areas, where you find a lot of persons, some persons, they haven't gotten a chance to, get a cleaning, for example, done or seen the dentist for ages. I get to understand just recently, just yesterday, we have a patient. She is over 40 odd years old and she has never gotten a cleaning done. So coming into these areas, it is good for our children to come and to experience outside of the dental office.
I think it's a real testament to what we're doing that I'd say like 4 times as many volunteers showed up this time, so it's just exponentially growing, which is really incredible. And I'm excited for all the work that we can do.
Just look at this program. We went on with this program last year. There's a great demand for it in the community. And as a result, we're here again. And the community has 100% trust us to do the efficiency that we have been doing over the past years with different community programs as well. If you look on the outside, there are so many different community members from all over the surrounding communities, the Bellas Gate, Cocoa Ridge, there is Camel Hill, there is Gravel Brown. There is so many different persons that are here and entrusting us to do a good job today.
I think the most unexpected part of today was just recognizing and understanding that there are so many individuals out there in my own country that don't have access to dental care. That was very unexpected and moving.
The program has been impactful, and I know with the continued presence or you being here more often, then it will continue to reach far and wide.
It's so important to us as a company to be able to give back to the community, to be able to come to such a remote community such as Bellas Gate. And because we do need to create a symbiotic relationship within the communities with we operate to build, foster, and maintain a sustainable social license in the areas of which we operate.
Jamaica has about 300 dentists, give or take a few, with a population of over 3 million people, which is, just not enough dentists as yet. So developing these community partnerships are super important because a lot of those dentists and the dental schools even are located in Kingston and the other urban centers on the island. So giving them an opportunity to come out to the country, they've seen firsthand how people really need access to dental care.
It's a big part of what we want to do to give back to the community that's welcomed us here.